Xerostomia. Our cavity has a complex watery fluid, known as saliva, which moistens the food in the mouth and aids in chewing, swallowing, and digestion. It also has protective functions, including lubrication, immunologic properties, and cleansing and buffering properties, thus preventing tooth decay. The saliva is composed of 98 to 99.5% water and 0.5% solids. Solids in saliva are inorganic substances such as bicarbonate, sodium, calcium, potassium, etc. Enzymes such as amylase, maltase, lingual lipase, and so on, and organic substances such as mucin, albumin, immunoglobulin, IgA, lactoferrin, etc. Saliva is secreted by three pairs of major salivary glands: parotid gland, submandibular glands, sublingual glands, and some minor salivary glands, such as buccal glands, lingual glands, palatal glands, etc. Approximately 1,000 to 1,500 milliliters of saliva is produced in a day in a healthy individual. Hypofunction of salivary glands leads to hyposalivation, where less than normal saliva is produced, both qualitatively and quantitatively. What is xerostomia? Xerostomia is the subjective sensation of a dry mouth. It is also called pasties or cottonmouth. When the unstimulated whole salivary flow rate is less than 0.15 milliliters per minute, it may be referred to as hyposalivation in xerostomia. Causes of xerostomia. There are various causes of xerostomia, some of which may be radiation therapy, certain medications, autoimmune disorders, aging, infections, and so on. So, particularly, when we talk about medications, there are certain medications capable of causing xerostomia, such as antidepressants, antihistamines, anticholinergics, and so on. Similarly, radiation in head and neck tumors, total body radiation, and radioactive iodine in thyroid cancer can also cause xerostomia. Autoimmune diseases like Sjogren syndrome and viral infections like HIV and hepatitis C can cause dry mouth. Xerostomia may be associated with aging, as aging causes decreased glandular secretion. Along with these, the habit of excessive smoking, mouth breathing, use of alcohol, etc. are also among different causes of xerostomia. Clinical features of xerostomia. Women are more commonly affected than men. As explained earlier, xerostomia is seen more commonly in an older individual due to structural changes in salivary glands. The patient may complain of a dry mouth, altered taste sensation, burning sensation, difficulty chewing, swallowing, talking, and wearing dentures. Different clinical changes are seen in the oral cavity, such as A. Dry mouth with thick, foamy, and ropey saliva. B. Changes in the tongue include a fissured tongue, depalpation, and a leathery appearance. C. Oral candidiasis. D. Dental caries, particularly cervical caries, and not root caries. During the examination, the gloves of the clinician stick to the tongue or buccal mucosa. Diagnosis of xerostomia. Xerostomia is assessed by clinicians based on a few chairside assessments, such as 1. Mouth mirror test. Here, the mirrored surface of the mouth mirror is placed over the buccal mucosa and is moved. If the mirror glides effortlessly on moving, then the salivation is adequate, or else hyposalivation can be suspected. 2. Lipstick sign. The patient may have lipstick adhered to the incisal edges. 3. Cracker sign. The patient states that he or she cannot eat the cracker without drinking fluids. Treatment. Treatment of xerostomia is conservative, symptomatic, and supportive. 1. Hydration, dietary modifications, and maintenance of oral hygiene are of primary importance. 2. Modification of medications in elderly patients improves the condition. 3. Symptomatic treatment includes frequent sipping of water and sugar-free fluids to prevent burning sensation, altered taste sensation, and minimizing chewing and speaking difficulty. 4. Avoiding smoking habits and alcohol intake can be helpful. 5. use of sialagogues, such as pilocarpine and cevimeline, sugarless gums and candies, and dry mouth oral rinse. 6. Topical fluoride application to the teeth should be initiated, and antifungal medications are necessary in the case of evident oral candidiasis.